Pledge of Allegiance. Please stand.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, good morning, good afternoon, good evening, everybody. I'll get it. First order of business is the approval of minutes. However, we cannot approve these minutes this evening because we have two missing members of the board, and they're going to put them off until our next meeting. But in doing that, I just want to thank our recording clerk, Dawn Cathcart. She has done a marvelous job.
Yes, yeah.
Just terrific. Thank you so much. I want to do it on camera. I want everybody to know how good you are. Thank you so much. The next,
You did an okay job.
the next is citizens' time. If there's anybody who's not on the agenda, there is nobody in the audience who is here for citizens' time, which brings me to chairman's report. And I want to thank two people on the board, actually three. I want to thank my call. First, our director, Susan, and Dr. Salzman, who have worked very hard in putting out some communications for both the schools and the community around the coronavirus. Thank you very much. They were excellent, they were professional, and people have thanked me. And I also want to thank David McSqueeney, who has sat on a multitude of subcommittees around the development of this community, and his expertise is noted. Thank you so much.
Thank you. Absolutely. Great.
There are no subcommittee reports this evening, but we do have a hearing. One of the reasons we are here this evening, I'm going to call on our health agent to please introduce Marlene Johnson.
Sure. So King Bebis, you can come right up and sit there. And would you please print your name on the sheet? So the owner is Julio Cesar Di Paula. He is not here tonight. He is sick. So his brother is Mr. Silva. He's an interpreter.
Sorry, Mr.
Silva.
Silva.
Silver.
Okay.
He is an interpreter. He does not work in the food establishment. And Mr. DePaula's wife, Mrs. DePaula, is also here on his behalf. She does not work in the business either, but they're representing him, and he did receive a copy of this, so he's well aware of what
This
the
is his
proposed-
brother, is that what you're saying?
Yes, this is
Okay.
his brother, who's the interpreter.
Interpreter,
Right,
okay,
and
and that's his wife.
Right.
Okay.
So they're both representing,
Is Mr. DiPaolo the sole owner, is he the sole proprietor?
is the sole proprietor.
So so we have some significant issues. If he's not here to respond to these issues, and two people are here who are not in the food industry, how does that work?
Well, we can
That's- I don't
provide
remember doing
him the direction, and we can vote on that direction as proposed by our health agent.
Correct.
And he'll have to take that back to the owner. And if the owner does not agree, you will have to consider closure, suspending the license or closure. So we don't want to go there. So we can talk about it among ourselves. Mr. and Mrs. Silva can agree.
Mr. Silver and Mrs.
DePaula's
DePaula.
Oh, Mrs. They can agree and take it back. I think this is pretty much what we're going to do anyway this evening.
So I think with the severity of the issue, I think we should at least hear it and listen through. I don't want to delay it to the
I
next
don't
board
want to.
meeting.
So, first of all, bem-vinda, which is Portuguese for welcome. Welcome. Thank you for coming. Thank you is obrigado. So, anyway,
Okay.
please.
So just a quick background. So in the fall of 2019, Mr. DePaula purchased Roma's Bakery. and with the intent of opening his own Brazilian bakery. And he has a baker that is full-time there. In December 2019, a pre-operation inspection was conducted, and the food permit was issued. And then on January 15th, I went in to do a routine food inspection, and I did find numerous violations. I don't know if you want me to go through them. They're on the page in front of you. I'm assuming you reviewed those. I can read through them if you want.
I'll ask the board.
I think they should be entered for the record, so.
Okay, you want me to read through
They are
them?
significant.
Okay. So the violations were, the person in charge at the time during the inspection, although was a certified food protection manager, was not knowledgeable and did not understand his duties as outlined in the food code. Note, the person in charge during this inspection was not the owner. All hand wash sinks, which there are 2 total in the establishment, did not have paper towels, or paper towels were jammed inside the dispenser. Thus, food employees were not washing hands properly. Raw ground beef was stored above cream cheese, so cream cheese is a ready-to-eat food. All raw foods are to be stored below ready-to-eat foods per the food code. The person in charge told me the food establishment does not sanitize when washing wares in the ware-wash sink. They only wash in detergent and rinse it off. So sanitizing is the next and final step in manual ware-washing procedures for the food establishments, again, per the food code. Temperature control for safety foods. These were pastries containing meats were inside a warming unit, but were found below 135 degrees Fahrenheit. So the minimum standard for hot holding temperature control for safety foods is at or above 135 degrees Fahrenheit. The person in charge did not have a food thermometer to take food temperatures to verify temperatures of any foods. 2 refrigerator units were not working properly. One was a display case and the other was a sandwich unit, and temperature control for safety foods were found inside. The person in charge stated the display case was fixed last week, but the person in charge did not verify all refrigeration units were working properly at the start of the day. Again, that's part of being knowledgeable and knowing your duties as the person in charge. Packaged bakery items for sale did not have a complete label affixed. They were missing the name of the food and the list of ingredients, including the allergens. The labels did have the name and address of the business on the label. So again, I just want to remind the board that these folks were not there that day, nor did they have responsibility at the establishment. When I did speak with Mr. DePaula, he was very cooperative and he was eager to learn. I went over what he needed to do, and he didn't seem to have an issue with that.
So I actually have one question for you, Marlene, before we have them address the board. But so is the person in charge, right, there's a certified food protection manager, are they a full-time employee? Are they there, and I guess are they there all the time? And what are the hours? What are the hours of the store, the bakery? Are they open 7 days a week?
Yeah, 7 days a week.
7 days a week? So is there always a person in charge that?
There has to be.
Yeah.
Yes, there,
I mean, I know there has to be, but I guess my question is, there's only one person that's a certified food protection manager?
You mean
no.
PNC?
Yeah.
You mean the
There's-
person in charge?
Yes,
There were 3 when they opened.
When they opened, there was
There
3?
were 3, yes.
but the
So,
one is not one.
The owner is one of them, but
Oh,
he
he
was
is.
not there during the inspection.
Oh, okay.
It was another employee
Gotcha.
who was certified, but obviously didn't know his duties, and he wasn't knowledgeable.
So, Mr. Silva and Ms. DePaula, we want you to be successful in Burlington, but we have standards because the community needs to be protected from every restaurant, every food establishment, and obviously, there needs to be some education. If your husband was here, we would tell him the same thing. We want to make sure that he is successful. We want to make sure that everything is correct, and we want to make sure that the public is is protected. Clearly, there's a breakdown, whether it be language, whether it be knowledge, whatever. But we have a recommendation from the health agent that you employ a consultant to make sure Mr. DePaula fully understands what he needs to do and how things need to be done within the bakery. And we hope you're here for many years, but he needs to understand these things. So would you please provide your recommendation?
Sure, so my recommendation
And,
is, I recommend that the board vote to require King Bibas to meet the following conditions. So condition 1, the owner shall hire a professional food consultant before February 25th, 2020. The owner shall provide the name of the food consultant and the name of the food consultant business to the health agent before February 27th, 2020. 2, the food consultant shall train the owner and managers of their duties and knowledge as outlined in the Food Code, Chapter 2, Sections 102 and 103. Number 3, the owner shall have complete coverage of certified food protection managers on site from open to close as required per local Board of Health regulations, and copies of their certification shall be on site. 4, the food consultant shall train the owner, managers, and employees in food safety procedures and warewashing as related to their business and as outlined in the Food Code and 105 Code of Massachusetts Regulations 590. 5, the food consultant shall conduct food audits in March 2020, April 2020, and May 2020, and provide a copy of these reports to the health agent within 7 days after the audit. 6, the health agent shall conduct an unannounced routine food inspection in June to see the progress. And 7, the owner shall appear before the Burlington Board of Health at a regularly scheduled board meeting on June 23rd, 2020 for a progress report.
Please.
So, while these so your recommendations, the establishment would be open for business and, okay. So, here's my concern that I offer for discussion. Along with what our chair just said about protecting the community. These are some of the most serious issues that we can have in a food establishment. How many food establishments do we have in the town of Burlington?
Almost 200.
Yeah. So, raw food mixed with ready-to-eat food, no temperature control, improper hand washing, improper cleaning of utensils. I would offer, and I understand this is a business, this is a livelihood, but this is our community, and this is our job. I would offer that the food consultant come in, but food cannot be placed, but they cannot serve the community until the food consultant actually signs off and says this place, the food consultant sees this as safe, regardless of what you're doing, Marlene. I'm just concerned that we're coming back in 4 months to see what's going on. You're following up whenever you're going to follow up. I just don't want this to be a service while being trained. These are serious issues. So I'd want to hear from the food consultant, everything is good, we're in a good place, I feel comfortable, and then we start serving the community.
So you're recommending we close them for,
I recommend that they not, whatever the term is, I recommend that the community not be serviced until the food consultant says that these significant issues, among whatever else may be the case, signs off and says everything is good, only because of the significance of these issues.
So this would be considered a suspension of permit with notice.
Okay, so I offer that for discussion. I know this is a first-time issue. The place has just been open since 2019. I also know the significance of the place that was before it. But this is what I offer for discussion in protecting our community.
So I actually, so I'm kind of on your page, although, I think it's a good discussion to have. What I was thinking while we were going through your recommendations, and I do think they're appropriate and well thought out. I was thinking, it's February 11th today, waiting for February 25th or February 27th and these violations occurred back on the 15th of January, right? I mean, there's got to be urgent, if we're going to remain open, there has to be more urgency around this by the owners, and I know that we have to schedule food
Right, they were
consultants.
given a list of consultants by me.
Right.
And I circled all of the consultants that are fluent in Portuguese, and I asked them to get started on that. So, part of it is too, the consultants need to be available,
Understood.
and they need to put them into some sort
But
of
I mean, we're
schedule.
giving them 2 weeks to even find a consultant, right? I mean, I think, why can't we give them till Friday to find a consultant, right? And then
We can do
potentially
that,
schedule.
we can do that,
They have been open all this time, they have not closed.
correct.
Yeah,
And
so-
how are you assured, and I support my professionals, but I need to just ask the question, how are you ensured that the critical violations have been corrected?
They were corrected
Corrected,
on site
They were-
during the inspection.
They were correct, all of them?
Yes, and then I met with the owner when I came back for a reinspection, and his brother was there and translated for me. So all of the violations were corrected when I was there for the reinspection.
And are you confident that they are cleaning utensils correctly now?
Yes,
Are you confident that the storage of beef is correct?
yes,
And look down, and the refrigeration units you noted are working?
they were working when I was there on the reinspection, yes.
And what about the paper towels and the dispenser that was squared away?
Those
so
were
it was
corrected
jammed?
on site and
So-
checked.
So all of these here have been corrected. Oh, and what about the packaged bakery items? Are these the ones that he makes himself?
Yes,
And does he have they been affixed, the labels and?
they're still working on that. They're trying to, I think the last time I was there, they were going to purchase, did you purchase the label machine? Yes? Yes, they wanted to get a professional label-making
So
machine.
he's been open and you feel confident that he can stay open but still needs the education?
Yes.
And they have a thermometer?
Yes.
So I just have one follow-up question to my first question. So, and I've never been in this establishment, so I'm not aware, but what kind of foods are they selling outside of bakery goods? Because there's raw meat, what are they serving that has raw meat? Like, what's their menu?
The bakery items, some of them have meat stuffed in them, so that's where the ground beef would come in.
But it is strictly, you would call it's strictly a bakery?
I would. That's their primary business.
I mean, I would be confident, and as I always are, in support of my professional, but I would like her to, if it's okay, my professional to go in and do another visit at least once a week, just to make sure.
Once a week? Is that what you said?
Yeah, just to.
I mean, is the person in charge no longer a person in charge, or have you talked to, I'm concerned, but I want to be fair.
Yes, I spoke to the owner, so he understands that.
So is that person in charge no
retraining
longer a
is-
person in charge?
I was told that they hired, you hired, or he hired somebody new?
Yes. So how about the other two persons in charge? Well, the owner's one, but the owner.
Right, I don't know if he let him go. He has the opportunity to do some retraining. I would hope that he would retrain the employee rather than let the employee go. The other thing I want to point out is that the consultant does an inspection as well. So when they come in, they're training, but they're working for the owner. So when they are doing their inspection, like I would do an inspection, they're more educational based, where I'm regulatory based. So by them going in once a month and doing an inspection, and they're sharing that inspection with me.
But I
We
would
know-
like you to do an inspection at least one more time prior to the consultant coming in.
Okay, I can do that.
And I personally would like to speed up the timeline as well.
I will make the concession of my consideration, if we, somebody available, availability aside, along with what Mr. McSweeney is saying, if we can get a food inspector in,
A consultant?
yes, thank you.
Consultant.
Thank you. Pronto, akin to what you were saying, then I would be willing to step back. I mean, this has nothing to do with trusting Marlene. This is, we haven't seen significant issues like these at the board level for a long time. So I'm nervous about this. And, so I'd go along with Mr. McSweeney, we have to move the timeline up.
Let's give them an actual date then.
Well, I mean, I think we should get they can find a food consultant by Friday, right, this week, whether or not they can come in as, around their schedule,
Okay.
right? But it needs to be,
So we'll say by, why don't we say February 15th? Friday's the 14th, but we'll give them till the 15th.
because of
And then
Valentine's
they'll-
Day.
And then they'll let me know on Monday,
Okay.
Yeah, that'd be great.
so that would be February.
And I agree with Dr. Weiner. I think that I would just feel better, given the significance, regardless of the fact they were changed that day. I'd feel better if you went in.
And the only other request I have, I think it's important that we stay and I know you are personally probably staying in contact with the owner, or at least have communication, through interpreters or whatever with the owner. I think I would like to see the owner back in front of us before June and maybe just give us a status update.
Okay. When would you like that?
I guess it all depends when the consultant starts, right? But assuming that they're gonna start in February, maybe in the March.
I like that. Maybe the first meeting in March.
First meeting in March.
Second.
Second meeting in March, whatever.
Yeah, whatever that one
We
is.
don't have a first meeting in March.
Yeah, second meeting in
Second
March.
Or whatever, the only meeting in March.
March, yep.
Yeah, that'd make me feel better.
Okay.
So I just want to make sure that these folks
Sure.
are clear on that.
Yeah.
So do you understand that a food consultant needs to be hired before this Saturday? So the list that I gave you, you want to make sure that you go through that list and call a few people, see if they're available to come out to your store. And we'll need them to come out once in February, and then March, April, and May once for training and for the audits. When I come out, I'm going to come out on Friday, so I will have an updated order for
And if they don't do that by Friday.
DePaula,
what's our-
okay, for Mr.
what's-
DePaula.
If they don't hire one, so I'm sorry, if they don't hire one by Friday, then what's our thoughts?
Well, I mean, I think, unless there's a substantial reason why one's not hired, I don't know what that
Well, that's what I'm saying.
substantial reason is.
That's what I'm
but-
saying.
It could be, somebody returning your phone call.
Well, if they start tomorrow and they call and call and call. So it's very important that you all hire a food consultant by Friday. It's very important, okay?
Okay, I just speaking on behalf of Mr. DePaula. He just not here because he was sick.
I understand.
Yeah, I understand.
Try call Marlene to try set up another day. I just apologize, but behalf on this, he struggled to reach and follow all the rules, make everything correct. And when Marlene was there, all the points was almost 100%, right? To make everything. And on Friday, then will be the company, the person will be hired to help him.
Okay,
Okay, great.
okay. And if you see no progress, then I would consider them shutting them down, if you see no progress. I will leave that to your, but I think that there has to be some progress here. You know, we want you to be successful, but we have responsibilities.
So, Mr. Chair, I would like to make a motion that we approve the recommendations by our health agent regarding food code violations at
February 15th.
no, I'm sorry, what's the, at King BB's Bakery with the following changes. That the food consultant be hired by February 15th, that the health agent goes in next week? Did we say next
I'll
week?
be there this Friday.
Okay,
Friday.
the health agent has another follow-up, and that Mr. DePaula come back to the board to report on progress, and I hope he's feeling better, by our meeting in March, with those either changes or additions to the recommendations.
Good.
I will second that motion.
I have a motion, I second. Is there any other discussion? If not, all in favor?
Are you good?
Are you okay with this?
Okay.
Okay.
And Marlene, are you good?
Oh, yes.
Okay.
Yes.
Okay, then, we're all set?
Think
All
so.
in favor?
Aye.
3-0. All set? All sorted.
Thank you so much, guys.
Thanks for coming in.
Have a good night.
Good. Okay. The environmental engineer is not here this evening. She is ill, which brings us to the health agent. You're back up, Ms. Johnson.
Okay, so, I've been doing indoor swimming pool inspections, January and February. I'm just about done, I have one more left, and, no issues, you know, some re-inspections, but nothing serious. And, our office has been receiving, some phone calls about mice sightings at the Burlington Mall. And I just want to let the citizens know that there's a lot of construction going on at the mall. I was there today, and in fact, they moved the main entrance over, and there's a lot going on. So it tends to kind of dislocate the mice, and they try to find a new place to roam. So the complaints...
It's also chilly.
That's true.
The mice want to be warm.
And the mice have been seen in the dining areas, and so I just want the public to know that we do inspections on a regular basis at the Burlington Mall. And when we do get these complaints, if we haven't been out there recently, we'll go out and we'll just check out the restaurant. All these cases, when we do check out the restaurant, there are no issues with mice infestation or anything like that. The restaurants there are clean and they're sanitary. It's just, the construction is bringing them out. So I just wanted to let the citizens know that.
Does anyone have any questions?
I don't.
You have any?
I'll make a motion to approve.
Wait, I have two.
Oh,
Spencer Gifts is going to be selling tobacco?
No, they're not selling any tobacco products.
Okay. And then the other question is, emergency response investigations. You had 12 of those. Can you give us one example?
Oh, that was, they were 12 stops. It was, I have it written down here.
That was
It was
the
the
water
Burlington
issue?
Mall, yeah.
Okay.
That was, running water was disrupted.
because they're supposed to close.
Yes,
No running water.
Yes, and they did.
And somebody didn't close.
just one.
I'm all set now. Do I have-
Well, actually, can I also say, so,
I want to make a motion to.
Well, you sound like, Columbo.
so I'm sure you're aware, but just because you smell chlorine doesn't mean that
Dr. Salzman, you were
Yeah.
not here at the last meeting because you were ill, very ill.
I was.
However, I did point that out to the board.
Oh, you did? Okay, then
in
I'm sorry for bringing that up again.
representing you,
Thank you very much.
I did present that.
In that case, I would like to do the honor of making a motion to approve our health agent's report.
Second.
I have a motion with second. All in favor?
Aye.
Aye.
3-0. Brings us to the Director of Public Health.
Yes. So we're working on our health fair. We've received all the applications now from the different exhibitors.
Already?
Well, we're having it earlier this year, so it's gonna be in March. So the date is March 28th. So we wanted to move it up, see if we could get more members of the public to come. So right now, we're not taking any more applications because we're full. We have 59
Wow.
exhibitors.
That's awesome.
Yes. So we have things like posture screening, bone density, the facial sun damage, have some new things this year, some stretching, so exercises. So there'll be more information on that to come. We'll start advertising for that. We also have on February 19th, 6 to 7:30, the Emerging Infectious Disease workshop, and that's gonna be at the Murray Kelly Room. So Harvard School of Public Health is going to be coming to do that for free, and that's been very popular. We have right now about, I think it's over 30 signed up for that. And then the last thing I wanted to mention was I had the technical assessment with the assistants, the ASPR office, the MRC ASPR office. And we went through all the factors of success on the website for MRCs. They're gonna start doing this again on a yearly basis. So we scored a 93% on our technical assessment, so that was good.
Fantastic.
Excellent.
Wow. How was that compared to others, do we know?
Well, the last time they actually did it was back in, I think it was 2012, like shortly after I became director. And I think we got in the 70s back then. There was a lot of things that we hadn't done.
Wow.
So we've improved a lot
To
since.
90, what was the answer? 93?
93, yep.
93. Excellent.
Was there any feedback to our letter to the schools, for the schools,
For the
with
the
regard to coronavirus? Yeah.
No, actually.
Did they get it?
We didn't get any calls or questions
Okay.
or.
It was very nicely done, so thank you for doing that. Okay.
I have no,
Mr. Chair, I'll make a motion to approve the Director of Public Health's report.
I have a motion and a second,
Second.
and I have a motion and a second. All in favor? Aye.
Aye.
3-0. Which ends our agenda a little bit early this evening, but I'm sure in reference to the coronavirus and most important, the seasonal flu, I'm sure that Dr. Salzman has some recommendations.
So I just want to make sure that everybody realizes that the coronavirus, although it has been declared to be significant by the World Health Organization and the CDC, we still are rated as low for the coronavirus in the state of Massachusetts. There still has been just one case in the state of Massachusetts. I am much more concerned with influenza still. And I am much more concerned not only because I am concerned about our older adults who and our children who have succumbed to it, but I myself had the flu and I got the flu shot. So I can only imagine how much worse I would have been had I not gotten the flu shot, because it does attenuate the flu if you were to get it. So all I can say to folks is, if you haven't gotten the flu shot, please get the flu shot still. Do we have flu shot?
Yes.
We have flu shot. Contact the Board of Health or look on our website. If you are ill, please quarantine yourself. If you are otherwise feeling okay, breathing okay, etc. If you need help, contact your provider. Hand washing still is the greatest way to prevent. So the coronavirus is out there. I think I heard via the reviews that are going on in China that they think that things in the central province, that they haven't noted anything escalating. I think things are status quo. although don't quote me, I thought I heard that. But here in Massachusetts, our risk is low. Flu is really what the issue is. I think somebody said that last week, when we were talking about the coronavirus and the concerns, and there just being one case from someone who had come back from China, that we had something like 300 additional cases that week in Boston. So, take care of yourself. Take care of yourself.
Mr. Chairman, for more information too, I forgot to mention on the coronavirus,
Thank you.
is on our website. So if anybody wants to get information on that, they can go directly to our website.
Right, www.burlington.org/department/Board of Health coronavirus information.
And Dr. Salzman? Please, the most important thing you can possibly do
I said that already.
is wash your hands.
Wash your hands. Washing, my hands were raw and wash your hands.
I have also had a number of questions, I just want to point out there, about our biosafety regulation that was passed just recently, and where it is located. It is located on our website, and if you'd like to read it, please feel free to click on our Board of Health website, and it's all there. And if you have any questions, please call our office. Anything, Mr. McSweeney?
Motion to adjourn.
Motion to adjourn?
Second.
Yeah.
All in favor?
Aye.
Good night,
Good night,
everybody.
everyone. Be
Stay
safe.
well.
Be safe. Be healthy.